In this presentation, we will cover the following. What's Medicare prescription drug coverage, Part D, Medicare prescription drug plans, Medicare drug plans costs, standard structure, improved coverage and the coverage gap, eligibility requirements, when to join and switch plans, Part D covered drugs, drugs not covered, how plans manage access to covered drugs, and requirements for prescribers. Medicare drug plans are offered by insurance companies and other private companies approved by Medicare. All people with Medicare are eligible to enroll in a Medicare drug plan. To get coverage, you must join a plan. Enrollment isn't automatic for most people. There are two main ways to get Medicare prescription drug coverage. Either join a Medicare prescription drug plan, PDP. These plans add coverage to original Medicare and may be added to some other types of Medicare health plans, but not Medicare Advantage MA plans. Or number two, join a Medicare Advantage plan with prescription drug coverage, MAPD, like a health maintenance organization or a preferred provider organization, or another Medicare health plan like a Medicare cost plan that includes Medicare prescription drug coverage. You'll get all your Medicare coverage Part A and Part B and your prescription drug coverage Part D through these plans. The term Medicare drug plan is used throughout this presentation to mean both PDPs, prescription drug plans, and MAPDs, Medicare Advantage, with prescription drug plans. Some Medicare supplement insurance, Medigap policies offered prescription drug coverage before January 1st, 2006. This isn't Medicare prescription drug coverage, however. Most people will pay a monthly premium for Medicare prescription drug coverage. You'll also pay a share of your prescription cost, including a deductible, if applicable, co-payments, and/or co-insurance. You can contact your drug plan, not Social Security, if you want your premium deducted from your monthly Social Security payment. Your first deduction will usually take 3 months to start, and 3 months of premiums will likely be deducted at once. After that, only premium will be deducted each month. You may also see a delay in premiums being withheld if you switch plans. If you want to stop premium deduction and get billed directly, contact your drug plan. When you are in coverage gap, you pay a certain percentage for covered brand name drugs and a certain percentage for covered generic drugs. In 2017, it's 40% of the plan's cost for brand name drugs and 51% of the plan's cost for generic drugs. With every plan, once you've paid a certain threshold of out-of-pocket costs for drugs, including payments from other sources like the discount paid for by the drug company in the coverage gap, you leave the coverage gap and pay a small co-payment for each drug for the rest of the year. Let's move on. Here's an example showing what you'd pay each year in a standard Medicare prescription drug plan. Not all plans follow this design. Your drug plan costs will vary. So monthly premium, most drug plans charge a monthly fee that differs from plan to plan. You pay this in addition to the Part B premium if you have Part B. If you belong to a Medicare Advantage plan that includes drug coverage, the monthly plan premium may include an amount for prescription drug coverage as well. Yearly deductible, you pay up to $400 in 2017. This is the amount you pay each year for your prescription before the plan begins to pay. No Medicare drug plan may have a deductible more than $400 in 2017. Some drug plans don't have a deductible. Co-payments or co-insurance, you pay approximately 25%. These are the amounts you pay for your covered prescription after you pay the deductible, if the plan has one, of course. You pay your share, and the drug plan pays its share for covered drugs. Coverage gap. The coverage gap begins after you and your drug plan have spent a certain amount of money for covered drugs. It's $3,700 in 2017. Again, in 2017, once you enter the coverage gap, you pay 40% of the plan's cost for your covered brand name drugs and 51% of the plan's cost for covered generic drugs. It may include a dispensing fee until you reach the end of the coverage gap. Certain costs count toward getting out of the coverage gap, including your early deductible coinsurance and co-payments, the discount you get on covered brand name drugs in the gap, and what you pay in the gap. However, the drug plan premium, what you pay for drugs that aren't covered, the discount for covered generic drugs in the coverage gap, and the dispensing fee don't count toward getting you out of the coverage gap. And catastrophic coverage. Once you reach your out-of-pocket limit, which is $4,950 in 2017, you leave the coverage gap and automatically get catastrophic coverage, where you only pay a small coinsurance or copayment for covered drugs for the rest of the year. Note, if you get extra help, you won't have some of these costs. In general, an individual is eligible to enroll in a Medicare prescription drug plan if the individual is enrolled in Medicare Part A and/or Part B, the individual permanently resides in the service area of a prescription drug plan, the individual is a U.S. citizen or lawfully present in the United States. An individual who is living abroad or is incarcerated is not eligible for Part D, as he or she cannot meet the requirements of permanently residing in the service area of a Part D plan. Medicare drug coverage isn't automatic. Most people must join a Medicare drug plan to get coverage. So while all people with Medicare can have this coverage, you need to take action to get it. If you qualify for extra help to pay for your prescription drugs, Medicare will enroll you in Medicare drug plan unless you decline coverage or join a plan yourself. You can only be a member of one Medicare drug plan at a time. When you first become eligible to get Medicare, you have a 7-month initial enrollment period for Part D. You can apply as early as 3 months before your month of Medicare eligibility. Coverage will start on the date you become eligible for Medicare. If you apply during your month of eligibility, then your Medicare drug coverage begins the first day of the following month. You can apply during the 3 months after your month of eligibility, with coverage beginning the first day of the month after the month you apply. Some groups of people who become eligible for extra help will be enrolled in a Medicare drug plan unless they join a plan on their own. We'll discuss these groups in Lesson 4. If you get Social Security or Railroad Retirement benefits when you turn 65, you'll be enrolled automatically in Medicare Part A and Part B. However, if you still need to choose and enroll in Part D plan during your initial enrollment period, if you'd like to have Medicare drug coverage, if you enroll later, you may pay a penalty. Medicare's annual open enrollment for Medicare Advantage and Medicare Prescription Drug Plan is October 15 through December 7, with changes going into effect on January 1st. January 1st through February 14 is if you are in a Medicare Advantage plan, you can leave your plan and switch to original Medicare. If you switch, you have until February 14 to also join the Medicare Prescription Drug Plan to add coverage. Coverage starts the first day of the month after the plan gets the enrollment form. Next one is April 1st through June 30, which is limited. If you don't have Medicare Part A coverage and enroll in a Medicare Part B during the Part B general enrollment period, which is January 1st through March 31st, you can sign up for a Medicare prescription drug plan from April 1st through June 30. Your coverage begins July 1st. You can change your Medicare prescription drug coverage when certain events happen in your life. These changes are called special enrollment periods. Each special enrollment period has different rules about when you can make changes and the type of changes you can make. These changes are in addition to the regular enrollment periods that happen each year. The special enrollment periods listed below are examples. The list doesn't include every situation. So some of those are if you permanently move out of your plan service area, if you lose your other credible prescription drug coverage, if you weren't properly told that your other coverage wasn't creditable, or that their coverage was reduced so that it's no longer creditable. If you enter, leave at, or leave a long-term care facility like a nursing home, if you qualify for extra help, you have a continuous special enrollment period and can change your Medicare drug plan at any time. If you belong to a state pharmaceutical assistance program, if you join or switch to a plan that has a 5-star rating, other exceptional circumstances like if you no longer qualify for extra help. It's important to know that, and it's important to remember that special enrollment periods for Part B and Part D have different time frames for when you can sign up for coverage. You may be eligible for Medicare Part B special enrollment period if you're over 65 and you or your spouse are still working and have health insurance through current active employment. Your Part B special enrollment period lasts for 8 months and begins the month after your employment ends. However, your Part D special enrollment period lasts for only 2 full months after the month your coverage ends. Plans are assigned their star ratings once a year in October. However, the plan won't actually get this rating until the following January 1st. To find star rating information, you can visit the Medicare Plan Finder at the medicare.gov. Look for the overall plan ratings to identify 5-star plans that you can change to during this special enrollment period. The Medicare NU Handbook doesn't have the full updated ratings for this special enrollment period. Medicare uses information from number of member satisfaction surveys, plans, and healthcare providers to give overall star ratings to the plans. Plans get rated from 1 to 5 stars. A 5-star rating is considered excellent. At any time during the year, you can use the 5-star special enrollment period to enroll in a 5-star Medicare Advantage only plan, a 5-star Medicare Advantage plan with prescription drug coverage MAPD, or a 5-star Medicare prescription drug plan. Actually, there is a 5-star Medicare cost plan, as long as you meet the enrollment requirements. If you choose not to join a Medicare drug plan at your first opportunity, you may have a monthly penalty added to your monthly premium if you enroll later. If you have credible coverage when you first become eligible for Medicare, you can generally keep that coverage and won't have to pay a penalty if you choose to enroll in a Medicare drug plan later, as long as you join within 63 days after your other drug coverage ends. Also, you won't have to pay a higher premium if you get extra help paying for your prescription drugs. The late enrollment penalty is calculated by multiplying the 1% penalty rate times the national base beneficiary premium, which is $35.63 in 2017, times the number of full uncovered months you were eligible to join a Medicare drug plan but didn't and went without other credible prescription drug coverage. The penalty calculation isn't based on the premium of the plan in which you are enrolled. The final amount is rounded to the nearest 0.10 and added to your monthly premium. The national base beneficiary premium may go up each year, so the penalty amount may also go up each year. You may have to pay this penalty for as long as you have a Medicare drug plan. After you join a Medicare drug plan, the plan will tell you if you owe a penalty and what your premium will be. You may have to pay this penalty for as long as you have Medicare drug plan. If you don't agree with your late enrollment penalty, you may be able to ask Medicare for review or reconsideration. You'll need to fill out a reconsideration request form that your plan will send you, of course, and you'll have the chance to provide proof that supports your case.